I've been out of residency here at Hampton Roads Orthopaedics for about 9.5 years. It'll be 10 years in August. And it's been a great experience. I've got to meet a lot of good patients, a lot of great physicians, and generally I've done pretty well with the surgeries that we've done here. I enjoy this very much. I can't imagine myself doing anything else other than this. And even if the climate changes and we're all in universal health care, I'll still be doing this with a smile on my face and happy to do it. Favorite part is seeing the patients and the effect that you have on their lives. Anything from giving people a cortisone shot into an arthritic knee when they come back a few weeks later and say all the pain is gone, up until patients who have operations that, we do these major operations, hip or knee replacement or spinal surgery, and they come back at 2 weeks or 4 weeks and they feel much better and they're back to doing their traveling, playing with their grandkids, or doing their sport again. And orthopedics seem to be able to give the best outcome or best immediate effect on patients' lives. You could take patients who are in a lot of pain from arthritis and you do a joint replacement or a spinal surgery, and the next day that bad pain is gone and they're able to leave the hospital within a day or two feeling much better. If you have somebody who has a bad hip, you replace their hip, they go home the next day, they come back post-op day 2 off their walker. A lot of them are already out shopping, they're going up and down stairs, they're having great pain relief right away, as opposed to other fields that sort of, you kind of treated chronic conditions and you didn't really have that immediate impact on their life. I think one of the most unique things about my practice is that I treat almost every body part. I operate on the spine, I do joint replacement, I do sports medicine. So I see a lot of pathology, I see a lot of different problems that people have, and it keeps me from focusing too much on one problem. So I have a lot of patients who come in and say, well, my back is the problem, and it really turns out to be their hip. I have other patients come in and say, well, it's my knee that's the problem, and it turns out to really be their hip. And so by having this wider range of patients come in from different areas, it keeps the mind open to say, well, it really is not the back problem. You don't get overly focused on one area and forget about everything else that's going on. So if you look at the doctors who practice here, I trained at Columbia University up in New York. We have physicians who train at Campbell Clinic, Boston University, UVA, Cleveland Clinic, some of the best places in the country. And we're providing some of the best treatments, some of the newer treatments out there to our patients. We're doing things that you can't even find in some of the big cities, such as the anterior approach hip, reverse total shoulder, kyphoplasties. We've been doing these things for years, and a lot of people around the country are trying to mimic what we do because the results are so good.